Project Opioid is excited to be bringing you this webinar today, the changing overdose crisis and how leaders can help make a difference. I'm Andrae Bailey again, founder and CEO of Project Opioid. Today, as always, we want to take a minute to thank Florida Blue and the Florida Blue Foundation. There would be no Project Opioid without Florida Blue and the Florida Blue Foundation, so thank you to them. And let me just talk for a second about who we're going to have on today. We have Sheriff Dennis Lemma on, Seminole County Sheriff, one of the great leaders on this crisis in the community and around the state. We have wonderful guest panelists, Maria Alonso, who is the CEO of United Way of Miami, Terrance Freeman, Vice President, Jacksonville City Council, Jennifer Webb, Director, Project Opioid Tampa Bay, and Bob Swindell, CEO, Greater Fort Lauderdale Alliance. So wonderful to have them here. As always, if you're logging in right now, welcome. There are questions that can be submitted through the chat box. You can email us, but just put questions in the chat box if you're wanting to ask something during the webinar. So let me just take a second to tell you about what Project Opioid is. Project Opioid is a coalition of business, faith, and philanthropic leaders working together to confront the overdose crisis in their communities. What Project Opioid does to save lives, it aligns cross-sector leaders, educates and increases awareness among those stakeholders, creates and shares data, formulates high-impact strategies, and ultimately works to find solutions and save lives. We're trying to build coalitions here and around Florida and work to bring people together on important days like today, Overdose Awareness Day. I want to take just a second and do a huge thank you to our 6 big Project Opioids in Florida, the Jacksonville Chamber, who is doing Project Opioid North Florida, Tampa Bay Partnership, working in Tampa, St. Pete, Greater Tampa, Miami-Dade Beacon Council, the Greater Fort Lauderdale Alliance, Palm Beach, and obviously the leaders in Central Florida. We're so thankful for their leadership. You're going to hear more about them today. So as you guys know, the crux of this webinar today is that COVID-19 has created the greatest mental health, substance abuse, and overdose crisis across Florida. How can leaders respond to that? We are talking today. All right, as you look at these rising overdose numbers, we know that leaders have to come together to address this in new ways. So the overdose crisis is changing and accelerating. We're going to hear from Dennis Lemma in just a second, but let me tell you 5 things you need to know as we start this webinar. Number 1, 5 big webinar facts you need to know today. Number 1, prescription opioids are actually down and no longer the key cause fueling the overdose crisis. This is new news. Number 2, the face of the overdose crisis is changing, with the number of Black and Hispanic deaths on the rise for the first time. Young people are dying at an astounding rate, with most of their increase in deaths driven by things other than COVID-19, overdose driving that the highest. Mental health of Americans has deteriorated greatly and is the greatest driver of the overdose crisis. And fentanyl has changed the game on this crisis forever, being the leading cause of death at 80 to 90% of the deaths across Florida. So go ahead and screenshot these. I won't go through these in great detail, but here's some more back information and data. Now, again, overdose crisis accelerated during the pandemic. Overdose deaths increased by 37%. That's the initial numbers that we have in Florida. Here's all the stats on the overdoses across America. This is a phenomenon we're seeing. We believe when the final numbers are tallied, over 100,000 people will have perished in 1 year from overdose. Number two, the crisis has changed from just a prescription pill crisis to a fentanyl crisis. Mental health issues are fueling this pandemic in new ways. Vulnerable communities are seeing the highest percentage increase in deaths for the first time in this crisis. And the pandemic is raging. We see a Delta variant. We have more cases of COVID than even previously we saw last year. We believe leaders today must look to do more on this overdose crisis, or we fear we will see a spike in deaths at that same level we saw last year of overdose. So how can leaders impact this crisis? We're going to take a minute now and hear from Sheriff Dennis Lemma, one of the top advocates in our state on the overdose crisis. He could not be here live because he had a very important meeting, but we're going to bring him in right now, show you an interview we just recorded with him. As always, if you have questions, put them in the chat box.
Well, thank you for all your leadership on this topic, on the overdose crisis we're seeing in Central Florida, and for the audience that's on this webinar across the state of Florida, really across America. There's this renaissance of the overdose crisis, especially we've seen during the pandemic, numbers of overdoses and deaths skyrocket. Dennis, you're so kind to come on, do a recording with us. You couldn't be there live with us because we are being cognizant of your schedule. But you know, we're so passionate about this topic because you're seeing in Seminole County and around the state, you work on this even beyond your community, overdoses skyrocket in the state of Florida. Dennis, what should we think about these rising overdose numbers right now?
I think we have to monitor this very closely, Andrae. And like, you know, we have spoken before through our efforts in Project Opioid that it is incredibly difficult for people to focus on more than one crisis at a time. And we know that because of COVID, now it's expanded to 18 months or so, that we've had daily news conferences about this, but the biggest thing in our country prior to COVID-19 was an unprecedented amount of overdoses. The sad news is those numbers have only been inflated as an unintended consequence of COVID-19. I'll give you an example. Seminole County is a very affluent county here in Central Florida. We've got a wonderful school system, great quality of life, very low unemployment rates. But you know, we've had 550 overdoses since January 1st, 73 overdose deaths, and these are unbelievable numbers. Our first responders deployed Narcan more than 500 times, or another way to say, bringing people back to life. There's a lot that we can do, and we know that this is 100% preventable as long as we get the right leaders, the business community and faith community, all aligned in common purpose.
Dennis, I think that you are spot on. And I'll tell you, one of the things that's been a challenge for me as someone who's involved with you and other leaders around the state on this overdose crisis is the frustration that it seems like we're struggling to deal with COVID-19, which is a very serious virus, by the way. The Delta variant has been kicking our butt here in Central Florida. It's spreading rapidly around Florida right now. It's something to take seriously. I know people that have died of COVID-19. I know you've had an officer on your team that died of COVID-19. We're not telling anyone to ignore the pandemic. At the same time, I will tell you, I have been frustrated, Central Florida, Florida nationally, with what I feel like is a need for more conversation across the board on this overdose crisis. There's press conferences every day around our communities, our family of communities, talking about COVID. But Dennis, we've got to add to those press conferences right now a discussion about overdoses, mental health. And I think if we do that, I think we can handle both these crises together equally. As a sheriff in a county, and you work with other sheriffs as well, how can community leaders begin to incorporate this pandemic response and the response to the overdose crisis that's happening in their backyard as well?
I think that that's kind of the key. In an incredibly divided country right now, it feels good to be a part of an effort that really unites everyone. I say this quite a bit, but it's so true. The greatest responsibility of any civilized society is to protect and preserve human life, regardless of your politics. So we find a strategy that works is one that includes everybody. By now, somebody knows of a family, a friend that has been on this journey. The sad part is part of the reasons why it's not being talked about more frequently is because I think that some jurisdictions in some areas really don't know their numbers, don't know how significant of a problem this is within their community, or there's some confusion about who's responsible for it. Actually, one of the reasons why we're doing this video right now and I can't be there live and in person is because all of the sheriffs across the state are coming together for a legislative summit. And this is one of our legislative priorities. Come together, police chiefs and sheriffs and mayors and community leaders and pastors. I have not met anybody who has heard the numbers, heard how this affects our families in our community, that has not raised their hand and said, "You've convinced me, tell me what we need to do." And this is the time for us to act. Project Opioid has the strategy. It talks about the partnerships that are necessary to be able to sustain this. And we have an appetite in Tallahassee. We have a governor, we have an attorney general, we have a first lady, and we have a legislature that's willing to devote resources to help our communities along. I think that we can capitalize on this moment.
For those of you that are joining this webinar, you're not familiar with Project Opioid, we'll put all the information in the chat right now. There are now Project Opioid collective initiatives in the 6 largest markets in Florida: Fort Lauderdale, Miami, Palm Beach County, Orlando, Tampa Bay, Jacksonville. And so if you're a leader, you want to get involved with Project Opioid, and we'll put all the information in the chat on that. Dennis, we talk about how politics seems to divide us on almost everything now, right? That's really a part of our society, as much as COVID seems to have become a part of our society. But what I find fascinating, Dennis, is when I look at Governor DeSantis and his wife and their work on the overdose crisis. I look at the Attorney General, Ashley Moody, and her passion. You guys work together on some pretty clear and quality recommendations you gave to the governor last March. When I look at those Republican leaders in Florida, and then I hear President Biden's plans for the opioid crisis he put out a few months ago, Dennis, I know it's not a popular thing to say, but there's a lot of alignment between the left and the right when you look at the concrete opioid solutions, like the expansion of behavioral health services, FDA approved medications for people who are struggling with these drugs. Dennis, we might find we're not as divided, left, right, conservative, liberal, Republican, Democrat, on the overdose crisis as we might think.
Yeah, I think that is absolutely true, Andre. And I find that, both sides, both parties, regardless of where you stand, even if you're not of age to recognize where your political alliances are, I think that saving lives is something that's easy for us to understand as a society. And then some of the underlying issues actually feed to the base of the politics of each party. As a conservative myself, we want less government. We want low taxes. We want to make sure that our communities are safe. And I'm not saying that's not what the Democratic Party was, but we know that if your parents are addicted to a substance or incarcerated, the children of those families are 8 times more likely to engage in maladaptive behavior later in life. So one of the big things that we're trying to do is stabilize people, provide them the help and the services that they need, which in the long run makes them self-sustainable so they can support their family and they don't have to be on our tax dollar to be able to be raised. Of course, the other side of the aisle has the, again, concerns, human element. We want to help people. We want to move people along. In a state that does not have expanded Medicare and Medicaid, there is incredibly generous opportunities through our business and our faith partners to close the gap and make sure that we help the people who are needing the services the most. So it's one of the things that we've done here through Project Opioid and in Seminole County that has yielded great success. But the problem is still out there and it's still a rising problem.
I'm Andrae Bailey. I'm the founder of Project Opioid. I'm here on our webinar during Overdose Awareness Day. Dennis, this is going to be broadcast August 31st, a day we're trying to bring leaders together around Florida to talk about this incredible rise in overdoses. Dennis Lemma is one of, if you don't know him well, this is a statewide broadcast, one of the most passionate and impactful leaders on this overdose crisis we have in the state of Florida. He works in Seminole County as the sheriff, doing all kinds of work on this issue. I think it's fair to say he's a very trusted partner with the governor, the first lady, the attorney general, and others on this topic. Dennis, 3 things I want to talk about before I get you off this webinar. And again, thank you so much for coming on and being our keynote. Number 1, we've got some new data that's coming out beyond just this incredible spike in overdoses. For people that don't know, and again, we'll put some of this information in the chat during the webinar, the state of Florida, every state in America has seen the highest rise in overdose deaths driven by opioids we've ever seen. 30, 40, and 50% increases in 1 year in deaths in counties around America. Nobody has been spared from this historic movement of overdoses. But Dennis, what's more troubling and things that we have to figure out together as leaders and communities is, number 1, we've seen a historic decrease in prescription opioids. Doctors prescribing to their patients, pharmacies, insurance companies. There really has been some positive movement. I think this is a good thing. You and I talked about this. This has been a good thing where we have reduced prescription opioids from 2018 to now alone by almost 70% in Florida. I mean, we've talked about how the Purdue Pharma, the Purdue Pharma situation with the Sackler family dumped all these pills on unsuspecting, unwitting Americans, and it caused a tremendous surge in addiction and in death. So we saw this reduction in prescription pills, but Dennis, during that same time period, the deaths by overdose have actually skyrocketed. So this is something that we're thinking about right now, because it's a good thing that we're keeping pills, these deadly, dangerous pills, out of the hands of people who shouldn't have them. But we're probably going to have bigger solutions than just a reduction in prescription opioids if we're going to save lives, Dennis.
Yeah, so, the numbers speak for themselves there. We had a huge problem here in the state of Florida. At one point in time, more than 90% of the prescription pills that were on the street were prescribed by one of the 900 pill mills across our state. People would actually travel down here to divert the pills back into their communities outside of the state. But what I think Purdue did and Big Pharma and that whole push was to create unprecedented addiction. In a very, very strange way, they made it okay to be addicted to a substance because it was being done with a doctor's note and a doctor's script, and it was occurring right underneath our noses. But when we looked at the evidence, we become aware of that. We did in law enforcement what we do well. We closed the rogue doctors down, the rogue clinics. We monitored how many people were getting how many pills. But what you can't do is you can't regulate somebody who's coming across the southern border with a backpack. Those pills that are pure fentanyl pills that are cut in clandestine labs, or a fancy way to say somebody's bathroom. We know that fentanyl is 100 times more potent than morphine, 50 times more potent than heroin. If somebody was on a prescription pill regimen for 5 years with 80 milligram Oxycontin, let's say, is their pill of choice, they're getting online, they're purchasing this stuff. They think it's the same drug that they're accustomed to taking, and they're nearly dying immediately. And now, even more concerning, we're seeing fentanyl laced in other substances, the cocaine, cannabis, all types of things. So the numbers are out there. Although we're prescribing a lot less opioids, there is no absence of getting your hands on opioids. Actually, one of the unintended consequences of Big Pharma kind of shutting this operation down is it thrusted all of these new drug dealers into a new way to synthetically process these drugs that are much more powerful and much easier to create and then get them into this country. It's alarming how big of a problem this is.
Supply and demand, Dennis. When the supply that Big Pharma, again, everyone agrees, Purdue Pharma, the Sackler family, I think we should throw these people under the jail, in my personal opinion. But I will tell you, we created this incredible demand for opioids in America. We pulled the prescriptions back, but so many people then turned to the streets for drugs. That's what the data kind of is telling us. And what they found was fentanyl. And Dennis, if leaders who are on this webinar don't really know the power of fentanyl, I'd love for you as a law enforcement officer who every day sees this drug just destroy people's lives. I tell people, Dennis, fentanyl is the most powerful and profitable drug in the history of street drugs. And it is unforgiving like no other drug. You take it a few times, one time too many, and you could be dead. How are you seeing fentanyl just destroy people's lives here and around Florida?
So, it's again, the most powerful substance somebody can take or receive. Many times the people who are taking it are not even aware that they're taking it. We're reviving people with Narcan, and we're saying, how long have you been using heroin and fentanyl? And they're like, I don't use fentanyl. Well, the pill that you just took was exactly that. And, we talk about the drug dealers processing this. We use words like clandestine labs, which really means somebody's bathroom. They're cutting this substance. A microgram is a lethal dose. We have, again, 100 times more potent than morphine, 50 times more potent than heroin. Carfentanil that's out on the streets that we're seeing as well is 100 times more potent than fentanyl. Just a little tiny bit. Again, it's mixed in sometimes intentionally, sometimes unintentionally, where somebody will be cutting these pills, processing them in pill presses, getting them out there on the streets. This is like nothing we've ever experienced before. Nothing.
Yeah, Dennis Lemma, Seminole County Sheriff, and one of the leaders, really one of the founders of Project Opioid. So glad to have you on. A couple other topics I want to cover quickly. I know your time is limited. But second thing that's really important, I think we talk about that's different today. I think prescriptions being down, overdoses skyrocketing, that's different than a few years ago. Another thing that's different, Dennis, is this incredible rise of overdose deaths, disproportionate rise in the Black community, the Latino community, and a continued skyrocketing rise in deaths in rural communities. Dennis, what's really challenging here is you're seeing the people that need help the most, you're seeing a disproportionate increase in them dying. And Dennis, when you really dive into the data, these are the same individuals who are the least likely to seek help, even if that help is available. We know many times it's not available. So I think, Dennis, this is not just an issue of those in need. Like we've thought before, maybe there's not enough Narcan, maybe there's not enough mental health services, maybe we don't offer people enough medications if they're struggling. I think all those could be true. But what's become clear is that we've got to have a conversation with some of those who are most vulnerable and rebuild trust sometimes in government, hospitals, law enforcement, because if that's the conduit of help, then oftentimes people won't reach for that help, even if it's right in front of them. So what do you think when you hear about these skyrocketing numbers among vulnerable communities?
I'm very concerned about the rise in communities of color, African-American community, Hispanic community, because I think that historically there's been a lack of trust. Law enforcement coming in and kind of sharing, hey, here's what we're experiencing, here's what we're seeing. You know, there's medical assisted treatment. A lot of people that are living and working and have their loved ones that are in this community or in these communities may not be always going to church. So we need to find a way to get those community leaders within there to know that there's resources that are available, that the gold standard for treating substance use disorder is medical assisted treatment. We need to make sure that people really understand Narcan because, in my opinion, Narcan should be in the hands of a lot more people than actually have it. If you have a loved one that you're around, it is incredibly important that you use Narcan, which is an opioid antagonist that reverses the effects of the drugs, essentially gives somebody 90 minutes of life. But again, this is, I think the most recent Project Opioid research shows 110% increase in the African-American community. And again, these are alarming numbers, 100% preventable. We need to make sure that leaders within these communities partner with us to help to get the message out there that there's something that we can do. Lastly, you know, we have a great network of resources that we've implemented in our partnership with Project Opioid here, where nobody is turned away. Uninsured, underinsured, people are given access to medical assisted, medical-based treatment, as well as cognitive behavioral therapy to get folks the help that they need.
Dennis, final question, and thank you again for joining us on our webinar on Overdose Awareness Day. Final question, as we see what our data tells us is a changing overdose crisis that maybe, if you look at the data a certain way, isn't as much just a drug crisis anymore, but is a mental health crisis driving a drug crisis, and a pandemic that has just put that on steroids. We've seen, again, increase in overdoses despite prescriptions being down, a historic rise in the Black, Latino, and rural communities of overdoses and deaths. And now the evidence showing that mental health issues because of the pandemic and an already eroding mental health capacity in America. Dennis, what would you say to community leaders out there right now in the middle of this pandemic in August of 2021 who have to deal with that issue but want to save lives in their community? Dennis, what's your advice to community leaders around Florida today?
Well, there's a group of incredibly important people that are listening in today that have immediate access and immediate resources, and we have an appetite to make a positive change. What the leaders need to do within their areas is there has to be somebody in charge of this crisis in each jurisdiction. Doesn't have to be a sheriff, doesn't have to be a mayor, it could be a business leader, but somebody has to stand up and be the point of contact. Hopefully, Project Opioid within the areas across the state now are that point of contact. Second is the governor, the first lady, the attorney general, our legislature has an appetite to do all that they can to help our most vulnerable in this space. But you as a leader in the community are going to have access to three particular funding sources. One, the American Rescue Relief Funds are available, and there is absolutely a correlation between COVID-19, mental health, and substance use disorder. And connecting the dots and making sure that some of that money goes to treat this unprecedented epidemic is incredibly important. Two, many of the larger cities across our state of Florida are in the multiple district lawsuits against Big Pharma. And as those settlement discussions are coming out now, there'll be a lot of money that is coming down as a result of those lawsuits to devote towards getting people the help and treatment that they need. And then lastly, through the efforts of our great Attorney General, Ashley Moody, the state of Florida is now in discussion about settlement, the $1.3 billion, and that will be money that we can use to really make a meaningful difference in people's lives. We can do this. The time is now, and don't take your eyes off this ball, because remember, the largest crisis that we faced in our country before COVID-19 was an unprecedented dependency and overdose problem, where it was a state of emergency nationally and throughout the state of Florida, 100% preventable, and we can make a difference starting today.
Seminole County Sheriff Dennis Lemma, thank you so much for joining us today, and thank you for all your service here in your community of Seminole County and around Florida. Thank you so much for joining us.
Thank you, Andrae, and thank you for your leadership.
Wow, great to hear from Dennis Lemma, great leader on this crisis. He's been fighting every single day to impact those in need. Again, if you have questions, put them in the chat box. You can email us as well. If you're a leader in Jacksonville, in West Palm Beach, Miami, Fort Lauderdale, Tampa, St. Pete, Orlando, and you're on this Zoom, we want to connect with you. So reach out to us in the chat box or reach out to us through projectopioid.org. So quick poll question. We're going to get and hear from some panelists, but a quick poll question. Which of the following do you believe has had the biggest impact on the opioid crisis? Number one, fentanyl. Number two, COVID-19. Number three, shutdowns and lockdowns. Number four, mental stress. All of the above. Poll question. So go ahead and put that in the chat. We'd love to hear from you and know what you think the greatest driver of this crisis is right now. Fentanyl, COVID-19, shutdowns, lockdowns, mental stress, all of the above. But now, as we move forward, we'll get you those poll results later. I want to hear from Bob Swindell, President and CEO of the Greater Fort Lauderdale Alliance, also the head of Project Opioid, Broward County. Bob, are you there? We'll check the audio here.
I am, Mr. Bailey.
The technology works. It's a miracle. It's wonderful. So Bob, you and I have known each other a while. You're going to be on our panel and we're going to have some other guests join in a second. But I wanted to give people kind of the mindset of someone who's a business leader working on issues every day, like economic development, tourism, transportation. Bob, your 9-to-5 job is helping lead the business community in Greater Fort Lauderdale. Why did you get involved, and why are you getting the business community involved with something like the overdose crisis?
Andrae, thanks for the opportunity to speak briefly, and I really enjoyed listening to Sheriff Lemma. He talks a lot about leadership, and I think that's the crux, in my opinion, of why the business community is involved in Broward County. I talked to my counterparts in other parts of the state. I think we're all seeing the same thing. To be honest, it's a stretch. It's not in our wheelhouse. But when we see things that have a direct impact on workforce and productivity, our businesses are having a challenge with workforce and talent as it is. And we know that issues like opioid epidemics, the impact it has on families, relatives that may not be a direct employee, but it may be someone close to the family. Those things definitely have an impact on someone's ability to stay focused at work. So we see that there's definitely an impact. Broader, the folks on this call, know this better than anyone, because I think if you're on the call, you're engaged. And I think what we have to do is repeat this message often when we're, among colleagues in business, whether it's over lunch or at a meeting, that, this is, to a large part what I've learned, and you and Sheriff Lemma sort of touched on this in today's call. Mental health is a huge driver in this. And, again, the folks on this call aren't surprised by it, but we've got to destigmatize mental health issues. Addiction is an illness. If someone were dealing with diabetes or renal failure, we wouldn't look down on them and say, oh, well, they made a lot of bad decisions. It's an illness. And I think that we have to approach it from the business community as an illness. And far too long, mental health and drug use have just been well, that's just a weak-minded person. That person, can't control, their own, impulses. And I think, the business community is going to have a broader understanding that, mental health is driving so many of our challenges, especially in our urban communities, but I see it in rural communities as well. I was up in Vermont for Independence Day and was talking to folks up there, and the opioid overdose epidemic is a crisis there in rural Vermont as much as it is in urban and rural Florida. So we're involved because we think overall it's a business issue. Sheriff Lemma talked a little bit about the safety net and how you take care of folks in your community. I'm trying to attract businesses to South Florida, and that corporate fabric and that social safety net is one thing that people look at when they measure a community. And I think Florida is the third largest state in the country. We want to become the 10th largest economy in the world. Mark Wilson would tell you at the Florida Chamber that we have to tackle issues like this in Florida if we want to be in the top 10 on a global basis.
Bob Swindell, President and CEO, Greater Fort Lauderdale Alliance. Bob, you're going to join our panel in just a second, but this is a question I think that many who are joining might wonder. When you think about a medical issue, or something that falls into the world of medicine, like the overdose crisis, I think, Bob, many people think, hey, listen, isn't that government's job? Isn't that the responsibility of government and nonprofits to fix this? Why business leaders, philanthropists, and faith leaders coming together in a coalition? Bob, what's the unique role of a business leader or the business community? What unique role can they play in a crisis like this?
Well, when we first met, Andrae, have talked about this, and there's a dynamic when you bring business people into the conversation. We have amazing people on the front line. I talk to Kathleen Cannon, the CEO of our United Way, on a weekly basis. We serve on each other's boards. I have a huge amount of respect for what our frontline folks are doing in Broward County and for the stories I hear from others around the state of Florida. And they're doing yeoman's work with, as always, limited resources. I think now when we bring in organizations like the Florida Blue Foundation, we shine a light on issues like this and bring a business perspective, which is really about how do we build a stronger coalition? How do we enlist our faith leaders, our philanthropy, our business leaders, and our frontline folks that have been working on this issue for years? How do we galvanize them and bring them together? And I think, a business plan and a business perspective, especially if we have resources that we can deploy with this issue, if there are settlements from the opioid lawsuits that are out there, I think as we direct those resources, we want a business perspective on this and business people, joining in and saying, listen, this is an issue for all of us. This is not something that's just going to be left to Health and Human Service folks and sort of leave it on their doorstep. This is something that impacts our employees and impacts their families. If we want a better community and to be able to attract people to our communities, we need to be able to show that we can manage this crisis and do the right thing for the folks that are most impacted by the opioid overdose issue.
Bob Swindell, President and CEO, Greater Fort Lauderdale Alliance, and a project opioid leader who is helping lead the charge to save lives in Greater Fort Lauderdale. Bob, you're going to stick around and pivot to our panel, and so we'll hear from you more in a minute. Thank you so much for your leadership. So now let's go ahead and bring our other panelists on. We've got about 20 minutes left. If you have questions, put them in the chat box. We'd love to hear more from you. But let's bring our guest panelists on. Maria Alonso is the CEO of United Way of Miami-Dade, also a part of Project Opioid Miami. We're so happy to have her on. Terrance Freeman, Vice President, Jacksonville City Council, also a big part of Project Opioid in Jacksonville. Jennifer Webb, Executive Director, Project Opioid Tampa Bay, one of our former legislative leaders. Jennifer is wonderful. We love having her on board today. And of course, Bob Swindell, who you just heard from a second ago. So we'll do a quick audio test. Maria, are you there? Can you hear me?
Yes, I am. Good morning.
Wonderful. Nice to hear from you again and see you again. Terrance Freeman, are you there?
Good morning. I am here. Hopefully you can hear me.
Wonderful. We can hear you and see you. And Jennifer Webb, are you there from Tampa, St. Pete?
I am. Good morning, everyone.
Wonderful, wonderful. So I'm going to dive right in and ask a few questions, and I'll kind of pop these questions around to our different panelists. But I'm going to start with this question. How has the opioid crisis changed, in your opinion, since the pandemic, and why do these changes matter? Jennifer, you're someone who's been touched by this crisis in a very unique way. I'd love to hear from you first, and maybe you can talk just a little bit about your story and how you see, the tragedy you've experienced, and now your leadership in Tampa Bay working together during this pandemic.
Sure, thanks, Andre. 7 years ago, my baby sister, who was the kind of glue of the family, she was everybody's favorite family member. She got addicted to opioids, just like straight out of an after-school special. Honestly, her friend took a prescription from her grandmother's medicine cabinet, distributed them to the other kids like Tic Tacs, and Allison got hooked. And because we hadn't changed the laws yet to shut down the pill mills, it was really easy for Allison to get more and more. And when that became harder, she went out onto the street. Medication for addiction treatment. Well, she reached out to us and asked for help, for me first and then my parents, and we got her into rehab and we got her on the path of recovery. But things that are commonplace today that are known to reduce fatalities, like medication for addiction treatment, and other programs, naloxone, weren't as prevalent back then as they are today. And so she didn't avail herself to all of that. We didn't know to carry Narcan. And I arrived home a few months later. She had been struggling. I knew that she had relapsed, and got home right in time to basically run towards her as she was pointing the gun at her head. And my mom, my dad, my brother, my spouse, and I were running towards her, begging her to put the gun down, and she pulled the trigger. And her suicide note was like every suicide note of a 19-year-old who's struggling with substance use disorder. It was, you'd be better off without me. I can't do this anymore, but I can't get sober. And please don't be mad. And it was heartbreaking. And it really did catapult me into public service to help change our statutes so that we could get more peer support specialists, so that we could expand medication for addiction treatment, so that we would have more incentives to do warm handoff programs and all of the things that we know to work. And then after elected office, it has brought me to say a resounding yes when Rick Homans from the Tampa Bay Partnership asked if I would come on board and help spearhead this effort. Because I honestly think that bringing the business community, the faith community, the philanthropic community together it could be the X factor that really helps to undermine this horrific trend that we're seeing in our communities.
Jennifer, thank you so much for sharing that personal story. And it's hard to even imagine losing a loved one the way you did, but your sister and her struggles, do you see more people, you've got a lot of data you're looking at in Project Opioid, Greater Tampa Bay right now. Are you seeing in your data in your community more people with mental health issues and substance issues?
Yeah, we are actually. I mean, there's an increase, and this ties back to the pandemic. I think to understand how the opioid crisis has changed since the pandemic, we have to look back a few years to what the pandemic exploited, the weaknesses in our communities, what the pandemic exploited. There's mental health challenges are on the rise. The stress, the uncertainty, the isolation of the pandemic has really either increased people turning to substances or increased the rate of relapse with those who are on a pathway of recovery. And of course, the explosion of fentanyl prior to the pandemic was basically cemented. During the pandemic, there's a lot of reports from law enforcement agencies about how drug dealers started cutting fentanyl into everything, and Sheriff Lemma mentioned that. And they found, hey, this is great because this is cheap stuff, and it makes the drugs that I'm pushing to people more potent, and I can basically extend my supply and make more money. And that trend has just increased. And so today, what we have is honestly like people with substance use disorder, people with mental illness who turn to drugs, like my sister did, dying. I mean, my sister would have probably died from an overdose if she were alive and struggling today, instead of out of despair of suicide. I honestly believe that because the fentanyl is so potent and so deadly and so pervasive.
Maria Alonso, President and CEO of the United Way of Miami-Dade, one of the largest United Ways in America. Maria, you are actively involved in all kinds of social issues. You work with nonprofits, government, business leaders every single day. You were a big part of distributing the American Rescue Plan dollars and stimulus dollars in your community through various programs. Maria, how are you seeing, as someone who coordinates leaders in one of the biggest cities in America, Miami, how are you seeing this opioid crisis increase and change during the last 16 months?
Good morning, Andrae, and thank you for having me today. As I think Bob alluded to, we're fairly new to this work, and we've seen the need, quite frankly, to again come together for what is a very different type of crisis in our community. In Miami-Dade County, that work is really being led by our official economic development agency, the Beacon Council, and my colleague, Michael Finney. So I'm happy to be a part of this. We're getting started. And I would say that what we've seen is that the pandemic has exacerbated already challenging situation. In our community, we have 54% of all of our households that are struggling, living paycheck to paycheck. And so the pandemic has only exacerbated that with, job loss, reduced hours, furloughs, and at the same time, increase the need for mental health services caused by, as Jennifer noted, isolation, depression, anxiety, uncertainty, and many people have been really turning to substance use, right? And in this case, opioids. So we're seeing an increase. The crisis has gotten worse. We've seen the number of deaths related to overdose increase by significant numbers. 38% is the data that I've seen. And overdoses in general have also increased by 57%, and that's in Miami-Dade County. So clearly that is not a trend. That's a trend that we've seen in Florida, as we heard from Sheriff Lemma in Orlando, but it's also a national trend, and it's an alarming trend. And so as we're talking about why business and why all of us coming together, it's because we're all stakeholders in the success of our communities, and the most effective campaigns and programs have over and over been those where everybody comes together: public sector, private sector, the philanthropic sector, and business community, all working together towards a common end. I think, Andrae, you talked about how this crisis has changed. It really has, morphed from a pill mill, which, unfortunately, we certainly had and probably still have to some degree in South Florida. But it's changed from that prescription crisis to now an illicit drug issue. And it really, not unlike the pandemic, not unlike vaccine hesitancy, it really is on all of us to create these coalitions and then arm grassroots organizations, trusted voices, faith leaders, and nonprofits to be able to work alongside, law enforcement, public safety, business leaders to make a difference and drive it in our respective communities.
Thank you, Maria. Terrance Freeman is the Vice President of the Jacksonville City Council. He's also the CEO of Read USA Incorporated. Terrance, I'm going to throw you a different question. Terrance, can you hear me okay? Always checking the audio and visuals.
Yeah, I can. Thank you.
Wonderful. You're looking good there, my friend. Thank you for joining us. TJ Ward in Jacksonville says very good things about it, and I love TJ and Daniel Davis there. But Terrance, let me ask you this. I mean, you're a member of government in Jacksonville. Jacksonville's a fascinating community in Florida. It's got business leaders working together on this crisis every single day now through the Jax Chamber. But when you think about, because there's brand new data, I know you and TJ have talked about this, where we're seeing some of the largest rises in deaths from 2019 to 2020 in the pandemic, in the Black community, in the Hispanic community, in rural communities, skyrocketing. Terrance, it seems like those who are often the most vulnerable at times are dying at the highest rates. The Black community, top of that list, 110% increase in deaths in the very beginning of the pandemic in the Black community, overdose deaths in Florida. Terrance, when you hear these numbers, as a leader in Jacksonville, what is your response?
Well, one, thank you for having me on, Andrae. My response is it's devastating. It's heartbreaking. And, it was one of the driving forces that led me as a former professional baseball player into education. And then from education to the chamber, it led me to this spot because I wanted to know how can I better serve those who are in most need. The one term that I always resort back to, especially when we start talking about issues in the Black community, is access. We know that access is the biggest challenge of transportation, if it's for healthy foods, if it's for your healthcare, and now in this situation when it comes to mental health. But I'll tell you, as discouraging as those numbers are, what we in Jacksonville have done as a community, I believe is just a template that is going to continue to spread throughout the region. And it's a lot of things that people have said on the call already, with the business community coming together, with our not-for-profit leaders and our faith leaders. But the way we did it, about 2 years ago, I had a young lady approach me with a very similar story to the person earlier, with the loss of a child. Her side of the story was more from a perspective of, we had the financial means to get our son everything he needed to get the help he needed, and we fell through the cracks. And why? Because there was a stigma. And then when I would go into the Black community and I would talk to people about the challenges of, their 7-year-old son just saw a violent crime happen right in front of him, and his fragile brain trying to process life and death happening right there, and the scarring that it does to it, right? That mental trauma. And their response would be, where do we go? So here in Jacksonville, we just recently started a mental health awareness campaign with Hearts for Minds, an organization that we're breaking down the walls and the stigma of it. And it initially starts with a mural, and we're doing this in every community, Boys and Girls Clubs. We're partnering with them. We're partnering with church leaders. We're bringing everyone to the table, and they take handprints and they make the handprints out. And from a distance, you'll actually see a butterfly. And as you get closer, you can tell that the butterfly is made and composed of handprints. But the caption is you have the power to change the power. You hold the power to change the power of the world in your hands, in the palm of your hands. But there's a QR code. And what we've done is we've just gathered all of our partners together. And so in that QR code, it sends this person to their place where they can get help. In closing, the next thing we did is, as a council, we made it a priority. It is a part of our strategic plan. We have a 5-year strategic plan that we visit every year. And where are we on addressing mental health? How are we addressing it? We have a special committee where we bring the fire department in, JSO in, community leaders in. And this is where we actually implemented Narcan training to everyone, all of our employees, and then distributed to them in our city. So it is a collective effort, but I'll just end with this. When we talk about, the business community and we talk about others, I think the one factor that we can't forget is we all live in the same city. Now, there are different parts of it, and everybody brings different skill sets to the table. But we live in one city and we're one family. And it's our job that when our brothers and our sisters are struggling, that we step up and do our part to try to assist them. So I'll close with that and welcome any further questions.
Andrae Bailey here, CEO of Project Opioid, with some wonderful leaders around the state of Florida. Let me pivot to the next question here. How should leaders respond to the rise in fentanyl deaths? Jennifer, I'm going to come back to you. You are seeing a tremendous rise in fentanyl deaths in the Black community as well. I think you have some data on that you've been looking at recently. But Jennifer, how do leaders, government leaders, business leaders, faith leaders, others respond to this rise in fentanyl deaths? As Maria said earlier, representing all of Florida and really all of America, this is moving away from prescription pills made by companies like Purdue Pharma, which those people are bad actors and they hurt thousands of people, killed tens of thousands of people by their overprescription. But today we're seeing this tremendous decrease in prescriptions and it's an incredible rise in deaths due to fentanyl. Jennifer, what are you seeing and how should leaders respond to the rise in fentanyl deaths right now?
Well, so the most important thing is to get the message out that recreational drug use is like playing Russian roulette now that fentanyl's on the scene. Fentanyl is in almost everything. And so if we just keep acting as if this is a pandemic that's only picking off people who have substance use disorder, then we're going to miss those increased or excessive deaths. So we have to expand our public health campaigns, expand our partners, get the message out in new ways that there is no such thing as safe recreational drug use, not now, and especially not now, if ever. If that message, your drugs are tainted. I don't know how we say it, but we have to get that out there because it's true. I mean, fentanyl was almost all of the opioid overdoses were caused by fentanyl in 2020. Almost all of them. All but 45 polysubstance overdoses. That's overdoses where there's fatal overdoses where there's more than one drug found to cause the death of the person by the medical examiners. Almost all of those involved fentanyl, not any kind of opioid, fentanyl alone. And so really, I mean, the evidence, the data is clear that to use drugs right now is to, gamble with your life. And so that, I think the business community can do a good job. So who could be recreational drug users? Well, your employees could be recreational drug users. Your family members could be recreational drug users. I mean, this expands the opioid epidemic far beyond what we have traditionally seen. And so what is your message to your employees? What is your EAP? What's your behavioral health coverage for your employees? All of these things are things that our business leaders are uniquely positioned to examine. And then finally, carry Narcan, pass it out, make sure that folks that folks who may be at risk of using drugs, even recreationally, have something that could save their life if things go south.
Maria Alonso, we've got about 3 minutes left, so I'm going to ask you for a quick 30-second answer. What is it that we can do, all of us, to break stigma down around mental health, substance use, and this deadly overdose crisis? What's one thing you would say to leaders out there in their community? What can we do to break the stigma and urge people to get help during this deadly crisis?
It could be any one of us, okay? And so the moment that we realize that it could be us, it could be our family, our friends, right? It is an illness and we have to treat it as such and treat it with respect and with urgency.
Terrance Freeman, you are a wonderful leader in Jacksonville. There's a tremendous stigma. There was a question in the chat about stigma in the Black community, the Latino community, around getting help for all kinds of medical issues. We're seeing people in the Black community, the Latino community, and rural communities not reach out for help when it comes to COVID-19 and this overdose crisis. They're dying in record numbers. What's your message to leaders on how we can bring more people to help when they need it?
Yes, first I'll say we have to lead by example. It's not enough just to stand in front of a microphone and command orders to others, and then we're not willing to walk it out ourselves. Second, we have to be willing to meet them where they're at. And so we're going to implement a program here soon where all sports programs, athletic programs, we're going to capture those kids, but then we're going to provide them with the wraparound services, literacy, the training, closing that literacy gap, healthcare, mental awareness. And we're going to charge every coach and every leader of athletic associations that this is a part of the curriculum that you must implement with every student and their families that are participating in sports. We're intentional here in Jacksonville, partnering with the chamber and other organizations, and we're going to be a part of really closing this gap.
Wonderful. Bob Swindell, I'm going to give you the last word. You're a friend of mine, and that you've crossed from the sidelines as a business leader multiple times to get involved in social issues. You did a great work on homelessness, partnered with the United Way there. Bob, what would you say to business leaders, philanthropists, and others who haven't been involved in this overdose crisis? Bob, as you hear, as we're closing this webinar down in the next 2 minutes, as you hear that overdose death in Florida, if you're 40 years old or younger, 35 years old, 40 years old, overdose death is the #1 cause of death in your community and in Florida, in every community in Florida. Bob, what do you say to business leaders and others about this crisis?
Well, I think I'd say what we've said with other crises. Business community has got to get involved. We've got to, partner with our healthcare providers, our frontline folks. I think Jennifer said it well. I mean, fentanyl is at the crux of so much of this. And we talk about just the overdose part of the epidemic and the number of people that are dying. People just, you don't know what's in a drug when you're taking it. There's no guarantee about the content. So I think we need to share those stories. We need to make this a bigger issue. We've had the pandemic that we've dealt with, and this is going to be a cascading impact from the pandemic. When we look at the isolation, the economic impact, I think that, we've got to talk to our local media, get stories, op-eds, get stories in the paper about the issue, but then also profile some of the people that have successfully battled this. People are very willing to tell their personal story. And I think that one of the most impactful things I've seen over the years is when you begin to destigmatize something by sharing people's personal stories and profiling some of the folks that are impacted by this. Maria said it well, it could be any of us. And we need to take that message to our community.
Final message here, get involved with us today. If you are not a part of Project Opioid, reach out to us. Again, huge thank you to the Florida Blue Foundation, Sheriff Dennis Lemma of Seminole County, Jennifer Webb from Greater Tampa Bay, St. Pete, Maria Alonso from the United Way of Miami, Bob Swindell, and Terrance Freeman out of Jacksonville. Thank you guys. Contact us. Today is International Overdose Awareness Day. Go to your social media, reach out to your employees, reach out to those in your faith community, make an impact today. This can impact everyone, and everyone can make a difference. Thank you guys so much. I'm Andrae Bailey. Reach out to me. We'd love to get you involved with Project Opioid. God bless and see you soon.
Thank you, Andrae.
Thank you, everyone.